Sarah Rae. Welcome to my channel. I hope you all are doing well. Today we are talking about lung cancer and how we found out my mom has it, how she is doing so far in her treatment, and how we are handling it so far. That is what we are talking about today. I hope you guys are ready. Let's jump straight into it. You know the drill. Like, comment, subscribe, hit the bell for notifications of when I upload, and let's get straight into this conversation. First, we have a few new crew members on board today that I'd like to show you guys. This is my mom's dog, Dobby. Dob. I call him Abu Dhabi. Oh, he's being shy. Oh. So this is my mom's dog. He is a Yorkie Poo. And he's a sweet dog. He is my almost service animal. He can attack whenever I'm having pain and anxiety, and he comes running in here and actually helps me. I will talk to you guys about that at some point, but yeah, this is Dobby. And then down here is Miko. Yeah. Oh no, let them see your face, Meek. He is hyper. He is a purebred Pomeranian. Miko, come down. Come here. Let them see your face. He has this beautiful tail. There you go. That's Miko. Show them your bone, Meek. Ah. Yeah. So those are my mom's dogs. Hersh, calm down. And you guys know Hershey, but yeah. So those are the new babies we got with us today. And you know Finn. Say hi. Thank you. Where do we begin? I guess how we found out my mom has lung cancer. I think that's a good spot. So I just gotten home from seeing my dad and my boyfriend in New York, and I got that bombshell about my dad, and I was trying to wrap my head around that. Oh, in case you didn't know, my dad has cancer as well. Try to wrap your head around that. There's days where I'm like, alright, that's it. They got that, that's it. And then there's other days where I'm like, what the F? Why both of them? Why? I mean, it's bad enough one of them, right? But both of them, why? It makes no sense. Anyways, just gotten home from finding out about him. He has prostate cancer, but it also spread, which, if you didn't know, when cancer spreads from one organ to another, it's called metastasize. So his metastasized to his lower back and hip, so bone. And I came home, saw my mom. Later that night when she woke up to go to work, she started to feel kind of ill. And the next 2 days she was like kind of sick, almost like we were figuring she had pneumonia or bronchitis, and because she gets those at least once a year. And the third night she woke up early. She was supposed to work that night. She woke up early and she could barely breathe. Like, she had a hard time breathing, and she has early stages of COPD, so she's on inhalers and just a breathing machine. And so she was doing that stuff. She had to call into work. She's like, I need to go to the hospital. So that's Harley on the scratching post. We took her to the hospital, and they did their test. They did a CT scan and found she had double pneumonia. And we're like, okay, that's a lot, but we figured she had like pneumonia or something. Then while there, they saw that in her right lower lobe, so in your lungs, your left lung has 2 lobes and your right lung has 3 lobes. Her lower right lobe, so the very last lobe, had these 2 nodules in it that weren't obviously supposed to be there. So they didn't know what it could have been. They were suspicious of it being cancer. They thought, maybe it could be, mucus, it could be masses they were naming all different types of things it could have been. But we were realistic. We were like, yeah, well, she's a smoker. We have a big time family history of cancer. That's what we think. When I say we, my mom is the one who believed 100%. I was believing the doctor when he said he believed it was just from the double pneumonia. But I would step out, call my boyfriend, freak out over what if it was cancer. Because somewhere deep inside of me, I felt like that was what it was. So let's weave in awareness here. So first off, what is cancer? It is a disease in which the cells in your body grow out of control. And lung cancer is when that specifically happens in the lung area, in the tissues of the lungs. Typically in the cells lining the bronchi and parts of the lungs, such as the bronchioles and things of that nature. Also, things to note is that lung cancer is the leading cancer-related cause of death in men and women. So, lung cancer is quite serious. Whenever they see nodules like that in the lungs, they typically do a biopsy of those nodules to figure out what exactly they are. Make sure that they're not cancer. So that's what they did. The next morning, because this happened at nighttime, so early that morning, they wheeled her in and did a biopsy of those two masses. And when the results came back, they came back as squamous cell carcinoma is what they told her, which is cancer. I stayed strong in the room. I asked the questions, Of course, he's just a doctor in the hospital. He don't specialize in oncology or anything. There's a lot of things that he answered that were wrong, like what stage she was in. There are 4 stages. 1 being that it didn't spread at all. 4 being that it spread everywhere. 2 being that it spread only 1, but in the same area. And 3 where it spread to another organ. So he said she was in stage 3, which she was not. He said that her treatment options were of 2 options. She could have surgery. Since both nodules were in her right lower lobe, they could just remove that lobe and then do a round of radiation. The other option was chemo and radiation. So they sent us to oncology. Let's talk about types of lung cancer. There are 2 types of lung cancer. One being small cell lung cancer, which this is 10 to 15% of people that have lung cancer get this type of lung cancer. It is also sometimes called oat cell cancer, and it's very fast growing and spreading. The other kind is what my mom has, the squamous cell carcinoma. It is called the non-small cell lung cancer, and it is the most common out of the 2. Obviously, it is the most common out of the 2. Is the most common between the two types. 80 to 85% of people who get lung cancer get this type. It mainly occurs in smokers and former smokers, but still is the most common even in non-smokers. Also it is common in women than men. When we finally were able to see the oncologist, he answered a lot of questions, like the fact that she was in stage 2, not stage 3, because it only spread to one spot, and that was right next to itself. It didn't spread to another organ or anything else. It just spread within that lower lobe, which means stage 2. And it found it really interesting when he was talking about stages that they commonly put together stage 2 and 3 when they talk about stages. So they really look at stages like this: 1, 2, and 3 together, and then 4. Because when they're doing treatments, they really treat 2 and 3 the same. So when he discussed treatment for her, he didn't feel like surgery was the best option. That what he's seen out of people who's had the surgery, that there was more success rate in people who got in the chemo and radiation than the surgery and radiation. And I asked them, why don't people just get the surgery, chemo, and radiation all together? Is that just overkill? And he said yes. I asked just a bunch of questions. So he sent her to do chemo and radiation. Now real quick, I want to tell you some risk factors for lung cancer. But do know that it can affect anyone, but if you have anything that I'm about to mention, they can raise your chances of getting lung cancer. So, smoking. So, when you look at lung cancer statistics, 9 out of 10 cases in men get lung cancer, and 8 out of 10 in women get lung cancer. Secondhand smoke, you very much can be affected by it. Family history, exposure to things like nickel, soot, tar, asbestos, probably saying that word wrong, radiation, HIV infection, and air pollution. So some of the symptoms for lung cancer are things like a new cough that won't go away, very persistent, coughing up blood, shortness of breath, chest pain, losing weight that you weren't trying to lose, headache, bone pain, loss of appetite, and fatigue are just a few symptoms that there are to lung cancer. Now let's backtrack here and talk about diagnosis. So when my mom was diagnosed officially, after the hospital they sent her to get what's called a PET scan. Speaking of PET, hi Harley. What are you doing, baby? Interrupting with your tail? The PET scan is when they send you through a machine, almost kind of similar to a CT scan or an MRI, but they send a sugar through your veins, and I don't know how this works scientifically, but the sugar reacts with the cancer cells and causes it to light up on the machine so they can pinpoint what is cancer cells in the body. And that helps them determine what type of cancer you have, what stage it's at, and the best form of treatment for you. They also do an MRI of your brain to see if you have cancer in your brain. So that is what my mom did. They also did a second CT scan to make sure that's what they saw. They are very thorough when it comes to diagnosing cancer. But they also do things like family and medical history and talking about the symptoms you have. They also do physical exam, imaging like I just talked about. Harley is next to the camera, I apologize. And they do labs on you, because if you have cancer, your labs will show there is something wrong. Also, again, like I talked about earlier, they will do a biopsy of that piece of tissue. And while we're at it, let's talk about treatments. I did talk a little bit about that already, but again, let's talk about a little more. There's surgery, which is cutting out the cancer tissue. There's chemotherapy, which shrink the cancer cells, killing it. And it also can be medication or through the IV. My mom, she is in chemo right now. She gets it through the IV, but my dad, he has to take medication. So really, your cancer treatment is really individualized. There's also radiation, which kills the cells as well, but there's also targeted therapy, which is where you take medication that blocks the growth and spread of the cancer cells. So a lot of these is used with another type of treatment. So think targeted therapy and radiation, or like chemo and radiation, or like I said earlier, surgery and radiation, or things like that. Now, when it comes to getting started with chemo and radiation, it took not too long, but a little bit. They had to set up a lot. It's a lot of planning and getting things put together in place. My mom's chemo, everyone's chemotherapy is different. So she has 7 weeks of that she has to go through, and 7 weeks of that she has to go through. And then radiation, it took a bit to get scheduled for radiation. Same for my dad, he has to go through radiation, but they have to go and get tattooed. So what that means is they put you in a machine, they double check, sometimes triple check the placement of where their cancer is, and then they tattooed the place, so they have a mark on them, just like tattoos. They have it where their cancer is, but on their skin. And the doctors, they do this because that is so they know where to place the machine and the laser to go to hit during radiation, because you don't want, when radiation's happening, it is killing off that tissue. But it's not only killing off that bad cell and tissue and everything, it's also killing off the good ones as well. So you want it to hit where it's supposed to, and try to limit the exposure to any good cells and tissue as much as possible. So they tattoo where it's supposed to go so they can place it just right. So each time she goes, which is every day, and same for my dad, every day, and they place it, make sure it's right, take that x-ray to make sure it's right, take that scan, make sure it's placed right, and then they do the radiation. And I think she has a harder time with the radiation than she does the chemo. I know she just gets really tired and fatigued from the chemo, but the radiation, she gets really nauseated, and just the radiation tears her apart. And my dad, he's about to start that. So it's every day. Hers is for 6 weeks, and my dad's every day for 5 weeks. That's what they have to go through. So let's talk about handling it. My dad's very military, baby boomer type. He's where I get some of my attitude from, where, or should I say thought process. You have it. There's no use really complaining or anything about it. It's not going to change anything. You just got to get through it. Do what you have to do. And that's very true. But that don't mean it don't affect you at times. That don't mean it don't tear you apart or tear you down, you know. So there's times where, you know, with my mom, I'm like, okay, I got this, you know. I'm her practical and emotional support here. I got this, you know. Then there's times where I forget to take care of myself, and it all just gets to me. And thinking about my dad, her, and then everything, like recently, I've been in a lot of pain and nauseous, and just yesterday I had to take a break. And that's what I did. I was like, I just needed to stop for a minute. Take care of yourself, because if you don't, how can you take care of others? And it gets to you. That's when it gets to you. It's when you're not taking care of yourself. But how can you help somebody in this instance? Well, I'll tell you, emotional support is one of the biggest things you can do to help somebody. give them a hug, squeeze their hand. You know, something me and my mom do 3 times means I love you. In the car when we're driving, I'll just grab her hand and squeeze it 3 times, and she just will smile and just do it right back. Sometimes just grabbing their hand is everything to them. Listen. Don't say anything, just listen when they want to talk, because they are going through so much. And also, don't say, I know how you feel, because unless you dealt with cancer before, you really don't. I mean, the only thing I can relate to is nausea. But in a way, I can't, because I don't know the type of nausea she's going through, how bad it is, because I'm not in her position. I've never had the nausea she's going through. I can just give well, here's a bucket for under your bed, because I know when I get really bad nausea, sometimes I can't make it to the bathroom. And that's always helped. And, you know, the whole be strong, be positive. That's not what they need to hear right now. But you listening and being there for them, that's what they need. And not taking things personally when they're getting angry or upset at you. I know there's times where my mom will get mad and yell at me, and I always say to myself, okay, remember this she's not mad at me, she's just going through a lot. Her world is completely different now. She's upset, she's grieving and upset, you know. They are going through so many different emotions that it can come out, and it's not anything towards you or me, and we just have to remember that. And it's nothing to take offense to. Help them. Be their practical support as well. You know, make some meals for them, throw some in the freezer for them to take out. I mean, they're exhausted. Sometimes they can't get up and move around because they're so fatigued from being drained. I mean, chemo and radiation takes everything out of them. I mean, chemo, they knock out your immune system to take out the cancer. Do something as simple as drive them to their appointment or help with cleaning and laundry. Little things, it helps. But always remember to be there for you as well. Think of coping skills for you, because that is important. Eat well, get enough sleep, that is important. Talk to somebody as well as for your feelings on what is happening for you. Therapist, a friend, somebody. Take breaks as well. I mean, you may not be the person going through it, but you are dealing with it as well. It is just as difficult on you as it is them. So my biggest outlet when it comes to feeling overwhelmed, thinking about both my parents, or Fridays because my mom has both radiation and chemo, or to de-stress, or if my mom is upset and I'm just like, okay, don't take it personally. I've gotten into sewing. I do my YouTube. I read. I distract. You guys probably know that word if you've been watching me for a while. I distract because I feel like distraction is so huge when it comes to getting through this, because it's going to divert your mind from what is happening to you and putting you in a different state of mind, even easing it, relaxing you for a while. It really helps. So that's what I have for you today. Let me know if you need more coping skills when it comes to this type of topic. I can make a specific video on that, but that's where we're at right now. She is just going through her treatments, and we're just powering through it right now. She has 3 weeks left before we are done, and I mean, she's still working, but I don't know for how long. She's thinking about making a GoFundMe right now because of the expenses of cancer treatment is ridiculous. And I think we are going to do that route, but that's a whole different topic. But that's where we're at. And my dad, he's about to start his radiation treatments. But besides that, his injections he is getting is helping. So on that note, his treatments are going well. So far, we're looking up over here. And then that's the good parts, you know. Thank you guys for listening and watching, and I hope you guys got some information about lung cancer through this video. And also, by the way, white is the awareness color for lung cancer, which is why I put the white ribbon drawing on my face to spread that a little more awareness for this video. Yeah, that said, thank you guys so much for watching. Let me know if there is something else you want me to raise awareness doing a video for. You can put it in the comments or email me. My email is in the description box down below. Also, I do have a P.O. box. If you guys want to send me a letter about it, you definitely can do that. That said, that's it. Again, thank you guys so much. I hope you guys stay safe and well, and I'll see you guys in the next one. Bye.